how about if you had that magic wand or that genie bottle and you could bring about any 3 changes in California for better health care? What would some of those changes look like?
Yeah. First and foremost, I would bring together behavioral health and physical health. Integrate those into one. It makes no sense to have 58 different county mental health services and at the same time have mental health funded differently. Everybody's for integrating mental health, but when you sit down and talk with the stakeholders, they want to keep it like it is. Well, you can't do that. And the provider community can't integrate care and coordinate that care if they have bifurcated systems. Human nature just doesn't allow that to happen. So first and foremost, that's what I would do. Secondly, I'd establish the ground rules and give it like a 5-year lead time and say that in 5 years, there are going to be 3 choices. One of them, Medicare, and I support having some options in Medicare like fee-for-service and MA, and Ian was correct. ACOs haven't been overwhelming. He used the word underwhelming, and I think that's accurate. But having some options for people there, and then we always have to have a third program for people that fall through the cracks. And there are 2 types in the United States. One of them is people that are legal residents that, just are not going to take it regardless. And then you have the undocumented and how we're going to deal with them because of the inconsistent federal policies there. And let providers across the spectrum get together and put the systems in place to meet that kind of a payment model. Now, all of the people in this room and throughout the state have enough ingenuity and intelligence, they can do things. But when the incentives are not aligned and people can still do things in siloed, fragmented ways, they're going to. And innovation and disruption, when it creates something that is new and innovative, a lot of the time, instead of being integrated, it becomes its own silo. And while it of itself is really good, and while the providers over here and the others that are in the silo, their own silos are increasing productivity all the time, the system does not get more efficient in the totality of healthcare. And that's the big piece here on that side of the equation. However, if we don't bring in the consumer side, the demand side of the healthcare equation, no matter what we do over here on the delivery side, we can't bend the curve. We can slow down the growth, but we can't bend the curve. Why? Because if people are obese, they abuse substances, they abuse tobacco, now marijuana, the inconsistencies are people want all this choice, but yet they don't want to spend more on health care, and we do things that are counter to the real goal, which tells me that we have to give a compelling case to people so they will think long-term rather than just short-term. And getting elected officials to think long-term is even more difficult because of their coming up for re-election every 2 years if they're in the House or the Assembly, or 4 years in the California Senate or 6 years at the U.S. Senate. There's no driving compulsion to do things that will give you the long-term results. And so what do? You tinker around, try to regulate the things that you see now that may be out of whack in the current view, pharmaceutical prices being a current example. They're bad, we know that, and some of the practices are also unacceptable. But it's not just pharma by itself. If we don't look at the entire healthcare equation, then we are going to miss the boat. We may do some things like pass a bill this year regulating prices in pharmaceutical products in California, but it doesn't really get to the core. What it does is put requirements on, and now they're going to have to, they'll inundate Bob, David, and Oshpod with paper, because that's the way the system is constructed. So our challenge is to avoid just layers and layers on top of the system in the hope that we're going to drive everybody into the right end result. We have to incentivize people to get there. And that has to be thoughtfully done with a lead time for people to do it.